for patients undergoing non-cardiac surgery. So the goals: to understand how to estimate the perioperative cardiovascular risk, to know when to perform stress testing preoperatively, and learn how to reduce risk perioperatively in those at higher risk. So what are the patient associated factors that put the patient at high risk before taking the patient for surgery, non-cardiac surgery? That is mainly the underlying comorbid conditions. More amount of comorbidity, greater is the risk for perioperative cardiovascular event like ischemic heart disease, congestive heart failure, diabetes, renal failure. If there is liver failure, cirrhosis or leading to low serum albumin. If there is undiagnosed hyperthyroidism, hepatitis, cirrhosis, I told you, and obesity. So coming to the overview, the epidemiology next. About 43.9 million inpatient procedures annually occur, out of which cardiovascular complications are the leading cause of morbidity and mortality following surgery. And this will cost about $20 billion annual cost. And this is the distribution of the procedure by gender. These in the males and this is the females. If you see, cardiovascular account for 23% in the males and 11% in the females. So what are the events that will trigger the perioperative cardiovascular events in the patients undergoing non-cardiac surgery? So the surgical trauma, anesthesia or analgesia, all this will produce, it's a pro-inflammatory state, and that is hypercoagulable state. So what happens? This may produce plaque fissuring or ultimately result in the formation of acute coronary thrombosis. This may produce perioperative myocardial infarction or the intubation itself. Then the pain because of any, like suppose if the patient is for fissure or whatever it is, that pain. Then hypothermia, if there is bleeding, fasting, all these are stress states. So which will increase the levels of catecholamines and cortisol levels. So they produce the stress on coronary arteries. So again plaque fissuring and acute coronary thrombosis and perioperative MI. In addition to this, they also produce increase in the heart rate, blood pressure, then relative insulin deficiency, increased free fatty acid metabolism, increased oxygen demand, that is perfusion and demand mismatch occur, again myocardial ischemia and perioperative myocardial infarction. In addition to this, they also produce a state of hypoxia because of hypothermia and analgesia. So we decrease in oxygen delivery, again oxygen and demand mismatch, so myocardial ischemia and perioperative myocardial infarction. Next, how do you assess the risk in a patient with non-cardiac surgery? So there are various approaches to assess. One is ASA criteria or DRIPS criteria, Goldman multifactorial index, Detsky modified index, and revised risk index, that is these are quantitative assessment, and other one is strategic, that is ACC or AHA task force recommendation. Commonly we use this revised risk index in our hospital. Next.